It's a pleasure to be here today to present our work on implementing a mobile health intervention for older adults living with HIV in Ghana. And yesterday, Dr. Abdullah, my co-author, sorry, how do I go back? Yeah, presented an overview of the different interventions we implemented, and today I'll be zooming in on one portion of it, which is the short voice messaging. I have no disclosures. Okay, so data from Ghana also reflect the global trend in demographic shift, and about 40% of people living with HIV in Ghana are 50 years and older. And this increase in aging population experiences and continues to experience very complex and intersecting health challenges. And like we heard from our fantastic speakers yesterday, older adults living with HIV face multiple health challenges, including cognitive and sensory impairments. And mobile health interventions have been very promising in transforming HIV care, for instance, in the area of promoting medication adherence among people with HIV. And although technology is growing among older adults globally, its use specifically among older adults with HIV in sub-Saharan African countries like Ghana is still limited. And so we sought to design and implement a short voice messaging system to provide psychosocial support to older adults with HIV in Ghana. And we conducted this study in 3 phases, and each phase built on the other. So for the first stage, we had the formative phase where we adopted Abrams and colleagues' 5-step framework for text messaging health promotion. And we conducted in-depth interviews with key stakeholders, including healthcare providers, and we also conducted several focus group discussions with older adults living with HIV to understand their perceptions and potential use of this new technology platform we were planning to integrate. And so here are a few quotes from the formative research from the interviews we conducted and focus groups. And one key stakeholder suggested focusing on voice messages, given that many older adults are still kind of new in this new, are still kind of computer or internet illiterate and still learning. And so voice messages were kind of suggested as better suited for this population. And we also heard from two individuals from who were living with HIV, and one individual suggested voice messages over text messages, given that the low literacy in this population. And we had another female from our focus group discussion who preferred that these voice messages be delivered in the local dialect instead of in English. And so we took these concerns into account, and to address literacy levels and language barriers, we ensured that these different short voice messages were crafted in different languages. So we focused on 5 key languages in Ghana. In Ghana, we have over 40 languages. And to address visual impairment and privacy and confidentiality issues, a non-interactive voice messaging intervention was determined practical for this population, given the visual challenges. And we sought to ensure that participants did not bear any costs in this intervention, and so participants used already existing feature phones and the messages with psychological support were delivered to patients or to individuals with HIV without any cost. And so following this first formative phase, we moved on to develop the intervention, which consisted of creating a library of these different short voice messages. And we had we covered several topics, including the importance of medication adherence, disclosure, importance of physical health and nutrition, and strategies to manage stress and build social connections. And so here you see just an example of a feature phone. And so participants were receiving these voice messages from the name like Aging with Grace. So that was how we sent these voice messages. And messages were sent 3 times per week over a 4-month period, and each message lasted about 2 minutes. And messages that could not be delivered or could not be received by participants were sent 30 minutes later. And the third phase included a quasi-experimental phase to assess the change in quality of life between our intervention group that received the short voice message and the control group. And here we have some background characteristics of our participants. So majority of participants in this study were aged between 50 to 60 years, and majority were of the female sex. Okay, so for results, the first figure shows the mean quality of life measures by the WHO quality of life domains. And below, the table below, we can see that at baseline, there was no difference in mean quality of life between our control group and intervention group. However, following the 4-week intervention, participants in the short voice message intervention had a significantly higher score for quality of life. And the multiple linear regressions also showed similar results, with participants in the intervention group showing higher quality of life. And we also observed that individuals that were divorced, widowed, or separated had lower quality of life compared to married individuals. And also individuals who did not live with other people with HIV tended to have higher quality of life. And evaluating this pilot study, we observed that messages were delivered at regular and convenient times for our participants, and the majority of participants suggested or were accepting of this intervention and recommended it to be continued. So in conclusion, tailored mobile health interventions can enhance the quality of life of persons living with HIV and aging with HIV by addressing context-specific barriers. And we recommend for next steps that we assess a similar pilot study in rural areas that have like low connectivity issues, because this intervention was piloted in the capital city of Ghana, in Accra. So this was an urban setting. So it would be important to also see how this reflects in rural areas. And we also recommend implementing multilingual voice messaging in diverse local languages, and maybe providing more options, more than 5 languages if possible. And ultimately, we hope that this pilot study can be integrated into national HIV programs to improve service delivery and improve the health outcomes of older adults living with HIV. And my colleague here is representing the government from the National AIDS Control Program, and hopefully this can be the beginning of a larger study. And In conclusion, I'd like to thank all our study participants for their time and to all individuals that supported this study. Thank you very much.
Yeah.